Jamila Mohammed is the mother of 4 children living here in Makali. She was a full-time mother caring for her children before the start of the war on Tigray. For a year now, her husband, who suffers from disability and other health conditions, have found it nearly impossible to support their children. She says her family is going hungry every day. One of her children, Abdu Jamal, is now suffering from malnutrition. And Jamila tells she is unable to find him medical care.
He is sick. He has trouble breathing and his nose is clogged. I took him to the clinic, but I couldn't get any medication there, so they told me to buy him medicine from a private pharmacy. People at the hospital helped me buy the medication. I had nothing at hand. My son's health had improved after he took the medicine, but now he's becoming ill again, and he's also suffering from malnutrition.
Jamal Hussein is Jamila's husband. He suffers from physical disability and also epilepsy, for which he needs medication. But since the start of the siege on Tigray, Jamal has not been able to access medication, making it difficult for him to support his wife in this difficult time.
In addition to my physical disability, I am also suffering from epilepsy, and I have to take medication every night. The doctors advised me to take my medication after a meal and to drink a lot of water, but I have nothing to eat, so I just take my medication. I take on an empty stomach and hope for God's mercy.
Jamila says her children's suffering causes her a lot of pain. She says going to the hospital to find that there was nothing doctors could do to help her children and become exhausting.
What's most difficult is the case of my children. They're okay when they have something to eat, but if they're hungry, they become difficult and I become stressed.
The story of Jamila and her family is the story of millions of families across Tigray that are suffering due to the lack of access to vital services, medication and food aid, a basic right, weaponized by the Ethiopian government.